Hello, my name is Erin Nagy. I'm an occupational therapist, and I've been working with the birth to 3 population since 2001. Today in this video, we're going to talk about different tummy time positions that you can use and give you some special tips to make tummy time easy and fun for you and your baby. So, what is tummy time? When we talk about tummy time, we're talking about any active position we use with an infant other than laying on their back. This does include laying on the belly to play, but that's not the only way to do tummy time. This video will show you several different positions for your baby, but all the positions have a few things in common. All of them allow for your baby's active movement. They all include interaction, and my saying is, stay and play, don't walk away. Use this time to really spend time with your baby and get to know each other. And the other thing they have in common is it's generally belly toward the floor. But as you'll see, that's not the only way to do tummy time. So why is tummy time important? First of all, tummy time supports your baby's development. And this can be in any area. It can be gross motor development or big movements that babies make, like pushing up on their arms, rolling, belly crawling, creeping up on their hands and knees, cruising along the furniture, or walking. Also, it supports fine motor development. That's using your hands together, using your hands and eyes, playing with toys, and eventually self-feeding skills. It also supports your cognitive, or your smarts. It teaches a baby about exploration and cause and effect. It also supports your baby's emotional development. It teaches them how to have a relationship with you when you're playing together, and it also gives them a sense of autonomy. It lets them know that they are active and they can cause changes and explore their environment. Another important thing that tummy time does for your child is it prevents skull deformity and conditions like torticollis, where a baby's neck is tight and twisted to the side. Spending too much time on their backs can actually flatten their soft skulls, and then later this will need treatment. Also, tummy time supports your baby's proprioception. Proprioception is a pretty big word, but what it really means is your baby learns their position of their body in relation to other things. All of these things are supported with a little bit of tummy time every day. So when should you start tummy time? That's an easy one to answer. You should start tummy time at birth. As long as your baby is healthy when they're born, you can start tummy time right away. Those first early cuddles are very important for your baby, so try to take the time to enjoy your baby with lots of skin-to-skin contact. If your baby hasn't had early experience laying on their belly, it's much harder to start later on. This doesn't mean that you shouldn't do tummy time if you didn't start at birth. It just means that your baby may need a little more encouragement to learn to like the position. So, how often should you do tummy time? That actually changes as your baby grows. At first, your baby may only tolerate a minute at a time, so start slowly and add more time as tolerated by your baby. Studies have found that babies need an hour of active tummy time play every day, broken up several times a day by the time they are 6 months old. That's why we use the rule of 10. The rule of 10 is this: for every month old your baby is, they will need 10 minutes of tummy time over the course of the day. Using the rule of 10 helps to guide how much tummy time is needed. If your baby is 2 months old, they need 20 minutes a day. If your baby's 4 months old, they need 40 minutes a day, and so on. You don't have to worry that you're doing too much tummy time. Just watch your baby and follow their cues. There are some special safety considerations to keep in mind when you're doing tummy time with your baby. When you're doing tummy time play on the floor, make sure there are no small objects around that the baby could put in their mouth that could cause choking. Keep any large pillows or stuffed animals away from their face so they don't suffocate. Watch out for any pets or siblings that may cause problems when your baby's on the floor. If they're crawling and moving, be careful about electrical outlets and the stairs. When you're playing with your baby, include different kinds of sensory stimulation. This can come from touch, from your speech, from the toys that you use, and for the movement that is provided. Don't forget my rule of stay and play, don't walk away. Your baby needs this time with you to keep them happy and learning. And don't forget our rule of 10 minutes of tummy time play for each month of age.
Okay, so in sitting, there's a couple different ways you can do some tummy time. First is the easiest one, which is the snuggle.
Snuggle. We like to snuggle.
Where you and Casey are going to be belly to belly. And when they're little, this is probably the first tummy time that they do. You can see her already lifting her head.
Mm-hmm.
Oh, and gets a good burp out. She has to look up, and babies love to see faces. So she can look at you.
Face. Hi.
There we go. And there she is. Happy baby. That's a perfect demonstration, Casey. Thank you. Hey, baby. There she goes. And Casey's showing us the colic hold. Lindsay's supporting her underneath with her hand on her belly. This is good when babies feel gassy. And it just gives them one more opportunity when you're walking them from room to room to sneak in a little extra tummy time.
Uh-oh.
Uh-oh, no sad.
You're picking your head up. That's good.
Oh.
Oh, my.
Okay, so Casey's showing us how we can play on the ball. And when you're playing on the exercise ball, you can give her a little rock so she's getting movement, which will help her when she's learning how to crawl. Oh, you can look at Mommy. Mommy's right here. Just keeping a good hand on her so she doesn't wiggle away.
Good job.
Okay, so when Casey's doing tummy time, if it's a little too hard for her, you can look at where her elbows are, because her elbows are a little wide right now.
Okay.
So I would take them, I'd slide them up underneath, and look how much taller she is already.
Yeah.
Sometimes a little back rub helps too. We'll get her moving. And from here, you can either put her up on her boppy. And boppies are nice because it, once again, is taking weight off of her chest. Oh, I know. I know. Get you pretty pictures to look at. You're gonna eat your hands. They're yummy. And one of my rules is that we stay and play, don't walk away. So while she's playing, come on in, Kendall. Look what your sister's doing.
Showing her
Help
how.
with tummy time. When she's playing on her belly, you can be her friend. And you can give her things to look at because she's falling asleep right here.
This is comfy.
Yeah, she's falling
You
asleep
could
right
tell her
here.
what color their hair is in each picture. Do you think you could start with this one? What color?
Black,
What color is this hair?
yellow, red and black, red, yellow.
And then Casey can look at all the pictures and you can tell her about them.
Yeah, so it could be a big help. And if you don't have a boppy pillow, you can use a towel that's rolled up.
Okay.
Or, when in doubt,
Hi,
baby, just stick her over your leg.
Oh, there you go.
And then once again, you can like get her little legs positioned. She's so little, but this is a lot of work for her. It's a lot of work.
It is.
You're doing a very good job being big sister for her.
Yeah, you know.
I
Yeah,
think she's using Miss Erin's leg instead of the pillow.
it works for her.
The best way to make tummy time easy for parents and baby is to make tummy time part of your normal daily routines, so you don't even have to think about it. A very easy time to incorporate tummy time is with every diaper change. But remember to keep your baby safe when they're on the changing table with our stay and play, don't walk away rule, as you normally would as you're changing your baby. If you think about how often babies go through diapers, that's a lot of tummy time every day right there. You can also link tummy time with your bath routine. After baby has their bath, you can give them a nice massage with baby lotion and give them a minute on their belly. A great way to make sure we're getting Casey enough tummy time during the day is if after every diaper change we put her on her belly, she can get in a lot of good tummy time during the day. And we can make sure we're going to stay and play, don't walk away, because it's not safe to leave her on her own. She could roll off at the table. Another important way to support your baby's development is to limit the time they spend in seating devices. And by this I mean car seats, baby swings, baby walkers, exercisers, or any other specialized seating equipment for your baby that doesn't allow them to have active movement. The best way to nurture your baby is to hold them. Your touch increases the connections between their nerves in your baby's brain, actually making them smarter, healthier, and happier. Holding your baby also prevents skull deformities and the torticollis that we talked about earlier. Babies who spend too much time in a car seat can develop skull flattening, called cornering, where their head actually deforms from spending too much time in their car seat. So don't have your baby sleeping in the car seat. Use it for its intended purpose. Use your car seat to get your baby from place to place and then take them out. Spending too much time in seating devices also delays their physical development. This is well documented in the literature. Babies who don't experience movement can't use their muscles to support themselves, and they may crawl and walk at later times. Spending too much time in devices also decreases bonding with the caregivers. Your babies need your touch to support a personal connection. Don't worry, you can't spoil your baby. If your baby learns that you're there for them, that forms the foundation of a lifetime of a relationship. There's a wealth of developmental information in many different forms available for free if you know where to look. First of all, you can talk to your pediatrician's office. Your pediatrician and the nurses that work there can help you find developmental resources. You can also go to your local library. Many libraries include books, magazines, videos, computers with internet access, toy lending libraries, circle time, or other playgroups, all of which are accessible for free. So find your research at your local library. You may be surprised what you can find there. There's also lots of online resources, but remember, when you're looking online, to check who the source is. Make sure you're talking to an expert and not just someone's blog. If you need search engine terms, you can look up tummy time or child development. If you'd like a recommendation for good online resources, here's a few that I've used and I recommend. Pathways.org, WebMD, MayoClinic.org, Parents Magazine. Thanks for watching my video today. I hope you have a better understanding of tummy time, its importance, its purpose, and how to get started. Feel free to post comments or ask questions and I'll get back to you. If you'd like to learn more, you can like this video or subscribe to this channel. Remember to hold your baby and give them tummy time every day.